All right, hello everyone, and welcome to my next generation NCLEX presentation. This will be relevant to your quiz, as well as your entire career in nursing school going forward. I find that a lot of nursing students who are entering nursing school for the first time have heard about the NCLEX and it's been talked about, and people are already stressed about it. For all of my natural born test takers, this will feel right at home for you. For anyone who has any degree of exam anxiety, which is most of us, I would say, we're introducing it really early because as we start getting into our clinical courses and our nursing focused courses work, our primary focuses are really going to be on how we can maximize our knowledge, not only to ensure the safety of our patients and the safety of ourselves and our competence, but as we prepare to take the board exam, which is the NCLEX, really understanding how the test works can help relieve some of that anxiety. So my goal for this lecture or video will be just give you an overview of what the NCLEX actually looks like, so that as you start getting into your courses, you can really hone in on what skills you need to focus on so that you can maximize your own success. I have a little sub thing here, how to get your license, because the NCLEX is how the Board of Registration in Nursing determines if you are eligible to get your license. It's the last step in the process. Beyond finishing nursing school and applying for your license and all of that great stuff, you do have to take an exam in order to ultimately prove that you have a basic level of knowledge to, in essence, not kill people, which is a great thing to do when you're a nurse. So I'm just going to talk about what the NCLEX looks like, how it works, and how the next generation NCLEX is going to impact you, because it is new to a lot of us. It came out in 2023, and so a lot of our nursing educators are still learning how to implement it. But for the NCLEX itself, it is an exam that is written by nurses. That is because we believe that nurses understand what nurses need to know best. And we maintain a very specialized area of expertise that makes it so that it makes the most sense for nurses to really hone in on what basis of knowledge we should have to move forward. There is a standardized structure to the NCLEX. If you've ever taken an exam like the SATs or the ACTs or any kind of standardized exam, this will feel a little bit similar, if not a little bit more intense because of how specialized it is. But you will start to get comfortable with the idea of answering different types of questions and how they're asking you certain questions and the like. The test is adaptive, which means no one has the same exam experience. No one receives the same set of questions. It will adapt to you as you perform. As you go through, your questions will change based on how well you're performing. So if you're just nailing every question, you're feeling really good, that's great. Your test is going to start getting harder. That's because the test is saying, all right, this person has a basic level of knowledge. We're going to start really driving home how well they're doing. And on the opposite end, if you are doing okay, but you've gotten a bunch of maternity questions wrong or a bunch of pediatrics questions wrong, the test really wants to make sure that you understand that content. So it's going to start asking you questions to really gauge how well you understand that topic. There's a performance standard, which basically means that as you're taking the test, there is a threshold between passing and failing. If you're above that line, it means you are practicing safely. You're not actively killing patients in your questions. And if you're below that line, then it's going to want to make sure that you can hit that line. So you'll always hear people say, oh, I took the minimum number of questions, or I took the most amount of questions, or somewhere in the middle. You can take anywhere between, and the number changes. It changed during COVID. It used to be 75, then it dropped down to 60. Which basically means if you're doing fantastic and you get to that final question and the minimum threshold, say it's 60, for example, the test will just shut off on you and you're not going to know if you pass or not. If you're above the passing threshold and the test is really confident that you're doing great and that's wonderful, then your test will shut off. If it's not quite sure yet, it's going to start asking you more and more questions. And it can go up to 200 questions, which can take you a couple hours. So it is a long test, but it really wants to make sure that you're above that performance standard in order to pass you. If you reach the maximum number of questions and you're just below that line, you're likely not going to pass the exam. It's determined that you may need to try again in order to make sure that you have that basic level of knowledge in order to protect the public. And again, this number has changed a couple of times, so I don't want to give you, I don't want to mislead you, but in general, it's right around 70 questions for the minimum. That means if you're doing great, you get to question 70, you answer it, and the test is confident that you're doing great, it's going to shut off, your test is over, you can go home, and then you can stress out for 48 hours. If you get to 135 questions, that's the maximum number of questions, which means if it's still not sure at the end of you taking your test, you may or may not pass. It really wants to make sure that you're hitting that 95% certainty principle. That means ultimately the test is 95% confident that you can move forward and get your license. And if it feels that way, then that's great. If you're below that level and you've hit the maximum number of questions, then now it's likely going to fail you. But we're not going to worry about that. We're going to focus on passing. You can also not pass in the minimum number of questions if you're just doing so terribly, or your anxiety has taken over and you're not really taking the test at the top level of performance that you can. It is possible that you can hit that minimum number of questions and not pass. It's also very possible and likely that you could hit that 135 and pass with flying colors. So the test is really designed to accommodate what kind of test taker you are. And it's really going to gauge how well you're doing based on your performance in those questions. Ultimately, the test wants to protect the public. It's saying that this person has the basic level of knowledge that they need to go onto a nursing unit or go into a hospital or go into any kind of nursing facility and operate at the most basic level that protects people from danger. Do mistakes happen? Yes, they do, but the test is just one more safety measure to make sure that we're not sending people who are unprepared into the nursing workforce, because people's lives are in our hands at that point. Like, we are providing interventions that can impact people's lives directly. We're giving medications. We need to understand how those medications work. You might be going hands-on with a patient, doing wound care, doing much more intense things than that. The test just wants to make sure that you, if given a nursing job, would not immediately start increasing the level of danger in the facility that you work at. It wants to make sure that you're able to think critically. It's not just going to ask you to memorize a bunch of facts. It wants to make sure that you can take the knowledge that you have and apply it to a situation, which we'll get into. It really wants to make sure that you can practice safely, ultimately. Is a test the best way to ensure that? No, but it's a good factor at play to make sure that we're really making sure we're covering everything. So as we start planning, you guys are still early. You haven't taken any clinical courses yet, but it is important that we start taking time to think about how we take tests, where our weaknesses are, and what our strengths are. So we start thinking about it now, because there are things that you can do now to help yourself, like do practice questions, for example. We're not expecting you to have all the knowledge in the world to be able to answer NCLEX style questions at this point, but just getting a feel for how they ask you questions is half the battle. For example, I came from an engineering background, and I was in a very challenging engineering program prior to going to nursing school. And so when I transitioned over to nursing school, I was expecting to just do great because I had taken all these really intense exams and I was doing all this super high level content and I was studying so aggressively. And I was like, this is going to be a cakewalk. It's just making sure that people are safe. How difficult could it be? And it turns out you can know everything, but if they ask you in a way that you're not expecting, you're not going to fully be able to perform at the top level that you think you can. And so I was humbled very quickly when I went to nursing school, because the way they ask you questions is not like any other test you'll ever take in your life. And it's not like any other kind of content you've done before. It's going to have very specific ways that it wants you to think. And so getting a feel for how they might ask you questions is a really good way to start getting comfortable with that kind of content. You will register for the NCLEX in your senior year. And there is a cost associated with it. When you graduate, you register for the NCLEX and you register for your nursing license at the same time. The application process addresses both, and it can be a little bit complicated. So what happens is you'll start approaching your senior year. You'll start submitting your applications and things like that. When you start thinking about graduation, that's usually when that process begins. The nursing department, the nursing board of registration in nursing waits for your school to submit that you graduated. It wants to make sure that you finished the program, obviously. After all that information is done, you'll be authorized to start taking the NCLEX, which then involves you going onto the website, registering, choosing your date, and then you'll take the test. You'll hear some people say they waited several weeks, they did a bunch of preparation courses. You'll hear people say they took it the next day. You'll hear people say they wait several months. It's really up to you how that goes. And it really depends on where you want to take the test. If you take it in a populated area, it might be more difficult to get a time that you want. But if you're willing to like go to New Hampshire, for example, or somewhere that's not directly in the city of Boston, you might have more options. It's just something to think about. If you're the kind of person who, like me, for example, I really like to take things the second I can, because if the longer I wait, the more anxious I'll get. So I'm someone who would take the NCLEX the next day given the option. If you're that kind of person, my advice would be to figure out how you want to go about that process and not do something that is not conducive to your way of thinking. But again, this is in the future. This is not a right now thing. Then you take the test. You will wait several weeks for your results. However, there is an option for you to pay a set number of money. Usually it's like $10. And they'll give you your results within 48 hours. And in my experience, what usually happens is they wait the full 48 hours. And so that can be a very stressful time. So things to think about. Registering for the test itself can be quite expensive. A lot of students don't expect the level of cost associated with it. So the NCLEX registration is usually between $200 and $250. And then registering for your license is another similar amount on top of that. So you can expect to spend about $450 to register for your NCLEX and for your license. In the event that you do not pass the NCLEX, you only have to pay the test fee again. You don't have to pay the full amount because you're only paying for your registration for your license once. But that is a cost to think about. So as you start getting towards that time where you're going to think about taking the test, you have to associate for that cost as well. The next generation of NCLEX. You will hear about next generation NCLEX a lot. That is because it came out last year. And basically what they did is they introduced a bunch of new types of questions. And those questions are designed to better gauge your critical thinking. So starting as of last year, it's impacting new students that are taking the test. Some people say it's easier. Some people say it's harder. It really depends on you. But as we get into test taking and things like that, you're going to start hearing more about it. The reason why it's really impacting us as educators is because all these new types of questions mean that we have to think about how we can best prepare you for those types of questions. And it usually involves doing a certain degree of critical thinking. It also means studying differently. It means learning how to critically think. It means doing more practice. And as you get into your clinical courses, we're going to introduce a lot of resources for you to be able to practice doing questions, whether it be a system like ATI, which we'll introduce to you, or something that you use in your spare time. I have an app on my phone that just generates NCLEX questions for me. And even now, I've been a nurse for about a decade now, and I still will pop open and do 5 or 10 questions just to keep my skills sharp, because I think it is important to be able to maintain those skills. And so if you have an app on your phone that you can just hang out on your couch and open up the app and do a couple questions and just get used to it, that's not a bad thing to do. That's how I prepare. I think it's a great way to do it. And then we get to Bloom's taxonomy. For anyone who feels like pursuing a master's degree in education, this is a lot of what we do. Understanding this is important because when we give you an exam in nursing school, it is going to be based on Bloom's taxonomy. And you'll see there are 6 levels. I'm only going to focus on the bottom 4, because as you get into more advanced topics, we'll start talking about the higher level ones. But for you and for this course as a freshman, I want you to fully understand how the bottom of this pyramid works, because those are going to be your priorities and as we build your knowledge. And so when I or any other instructor develops an exam question for you, what we are doing is determining at what level of Bloom's taxonomy we want that question to be, to figure out how to best test your knowledge on that subject. For example, if I wanted to test whether you know your lab values, is that something you could brute force memorize? Probably. If you know what your normal potassium levels are, that's just a matter of, do you have that memorized or do you not? Do you know the number or do you not? That is a remember level of understanding. And so things that involve you having knowledge in your brain that is easily recalled, a factor recall basic concept, that is on the remember level. So if I was to say, which lab value is normal for potassium, and gave you a bunch of numbers, if you know that a normal level is 4.0, that's great. You get that question right. If you do not have that memorized, you get that question wrong. Those are considered the most basic level questions for us. And they really involve you memorizing. That's just the nature of what it is. The next step up is understanding. That's going to be more like, can you explain the idea or the concept? Can you classify? Can you describe? Can you get a little bit deeper into what's being asked? So a question might be, I don't know, if you're asking about potassium, which of the following findings would a nurse expect for a patient with a high potassium? Like, does that involve you memorizing? Yes. Does that involve you understanding the concept? Also, yes. You have to understand what that lab value looks like and what the implications might be. So there is a degree of you being able to process what the question is really asking you and applying it to your knowledge, which brings us to our next level, which is applying. And this is where I would argue the bulk of your nursing exam type questions are going to be. As you build up, you'll get more and more types of applying questions, which is taking information that you have, understanding the concept, and then applying it to a situation. Like a nurse walks into a patient room, their patient is showing these symptoms. What intervention would the nurse want to implement to address those concerns? That involves you in a situation where you have to take your knowledge that you have memorized and that you understand the concepts of, and then applying it to a situation. Can you interpret what's going on? And can you apply an intervention that solves that problem? That gives us kind of our foray into critical thinking, because you're not just being asked, do you know this? You're also being asked, do you know how to apply this? That's where some of the challenge comes in. And then we get into analyzing, which here's a bunch of information. Now you need to figure out what you're going to do, because there's not just going to be one answer. There's going to be multiple answers. How do you prioritize what you're going to do first? What concepts do you need to utilize to bring about the best outcomes for your patient? When we look at case studies, like a situation that unfolds over time, this is more in that analyzing kind of way of thinking. It's, here's a bunch of information. Number one, do you know it? Do you know what you're looking at? Number two, do you understand what you're seeing and what you're trying to do? Can you interpret that information, and then can you make decisions that improve the quality of care for your patients? That's where we're at with this. And so as you start getting into your clinical courses, the first types of questions you'll see will really be in that remembering and understanding phase. Just, did you memorize this? Do you know what it means? And then you'll start getting into, now that you know what it means, how can you apply that to a situation? And if this was to appear in an overarching situation that unfolds over time, can you apply your analysis and really make sure that you, number one, fully understand, number two, are able to apply, and number three, analyze and make good decisions based on that information? That is how Bloom's taxonomy works. And that is kind kind of the way of thinking that we expect you to start getting into as you get further and further in your nursing school career. We're going to get into question types next. And a lot of these will be familiar to you. There's primarily multiple choice as the first one. You'll be like, oh yeah, I know what a multiple choice question is. You have a question, you get 4 choices, choose the right one. You might also have a question that is multiple choice, that here's 4 correct answers. Which one is the most correct? We'll get into that as well. Multiple responses are, here are 6 choices. Choose all the ones that apply to this situation. We'll have drag and drop, which I will demonstrate later. We have drop downs, which there's a drop down box. Choose the best answer. It's kind of like multiple choice. There's highlight. Here's a paragraph. Highlight the relevant information. There's bow tie, which we'll get into, which I think are the most complicated to fully understand. But when I demonstrate how they work, you'll be able to figure it out. And then trending and case studies. Those are unfolding situations where a patient's status will change over time. You'll be given different questions based on their status. And it's just like a multi-step series of questions that address the same overall situation. And so let's get into it. I'm going to bring up my handy dandy ATI, which you will be given access to once you start your clinical courses. And what ATI basically is, it's a suite of learning tools that gives you not only content, but also practice materials as well. So as we get into it, I have this question overview type quiz that will give us a bunch of different examples of questions that we might be interested in looking at. For example, if I start going back here, and you can see that I was playing with this a little bit, but getting started, here's a type of question called the highlight question. And what it's doing is it's giving you a bunch of information. As you can see, we have different exhibits, different types of information, and not every question will appear this way. This is just how ATI is presenting it to us. But we have multiple options. We have to go through, make sure we understand the content. And then the question is asking to highlight information based on what the question is asking. So this question is asking what makes this location the better choice. If you were going to get an eye exam, I have to understand what it's asking me. And so if I look at these options and I see, all right, the first point is the price. Which one is cheaper? Obviously, All About Eyes is cheaper at $65 versus $85. So that might not be a good example of what makes the eye place a better option. It's not asking us about glaucoma screening. It's not asking about these because they're the same. We get free frames with eye exam to a $100 value, whereas the other place gives a $5 value. Obviously, you want the $100 value, so that's a good option. I would choose and highlight that. You get a warranty, $30 off new frames. You know, that's probably a good option as well. I don't see anything about All About Eyes offering a warranty. So what I'm doing is I'm highlighting options based on what the question is asking. Relatively straightforward, involves you to be able to navigate and figure out exactly what the question is asking you, and then applying that in a highlight sense. So I'm just clicking the options that make the most sense and I'm highlighting them. I hope that makes sense. Next, and these ones can be a little bit more confusing. These are bow tie questions. And so if I am looking at this question, and it's not even in applying to nursing, it's a supernatural investigators following up on reported sightings of supernatural creatures. And it gives me a bunch of exhibits, a bunch of reports. An adult who has partial vision loss, sees blurry lights over the airport, says they're UFOs. 15-year-old thinks he sees Bigfoot. Adult sees spirits. School-age child gets on the back of a riding dinosaur. LOL. And what it's doing is it's asking me to complete a diagram, and this is called a bow tie because it has the vague shape of a bow tie. It's asking me to specify which reported sighting is the most viable, meaning what should I look at, 2 locations that they should look at, and then 2 pieces of equipment that they should take a look at. So if I was looking at these and I was trying to figure out, all right, which one of these makes the most sense? I might say, you know what, guy who sees extraterrestrials or a person who sees sea monsters, maybe that makes a lot of sense. So if I was going to choose the extraterrestrial option, that's great. Now I'm going to choose which locations are going to apply to that. And this would probably make a little bit more sense if it was in a clinical perspective, like potential diagnosis. You choose pneumonia. What are two things you might want to observe? Their type of breathing, and if they have any weird lung sounds. Say they sound like they have fluid in their lungs. What am I going to use to do that? Maybe a stethoscope, and maybe I might get a sputum sample or test their phlegm or something. You get the point. But if I was going to look for extraterrestrials, I'd probably check out, a peak observatory. That sounds like a good idea. I might go to a mountain range. I would probably go to the Pacific Rim because you're able to see things. And then for equipment, I might use a long distance camera, and I might also, want to use a star chart to make sure that I understand what the stars look like. I don't know. It's a weird type of question, but you're taking all this information and you're applying it based on filling out what the diagram wants you to fill out. And like I said, if this was clinical, it might make a little bit more sense. If your primary concern was the patient had a fever, how would I want to evaluate that? I might choose 2 types of assessments that I would do to make sure that my patient's doing okay, and I might determine what equipment I would use to make that decision or make that determination. That is a bow tie question. I think they're the most confusing type of question because it's not always obvious how the question wants you to answer it, but the more practice you do with these, the better it'll be. Moving on, these are matrix style questions, and they operate kind of like individual multiple choice questions. So for example, I'm given 3 categories. I have favorite books, favorite sports, favorite classes. What the question is asking me is to go down this list and determine which category each of these items falls into. So is tennis a book, sport, or class? It is a sport. Is chemistry a book, sport, or class? It is a class. Is choir a book, sport, or class? That's kind of a weird one. I wouldn't classify it as a sport or a class, but if I had to choose, I'd probably say a class. Spanish 2 is a class, could also be a book. Baseball, definitely a sport. And you can see I can only choose one option. I don't have the option to choose multiple. And so as I go through these, this is an example of a matrix type question. Relatively straightforward in comparison. Treat each level like a multiple choice question. We have a drag and drop question. Drag snacks from the snack choices below to fill each of the following sentence. The friend should choose blank and blank to share during the movie. We have available options, snack preferences. And so I have to go through and figure out, all right, if they're going to share, these are the available snacks. Friend 1 loves peanut butter and is a vegetarian, so that immediately eliminates hot dogs, beef jerky. Soft pretzels with cheese might be removed as well. Butter popcorn as well? I don't know. This person loves chocolate. Friend 2 loves chocolate. Friend 1 loves peanut butter, so this might be a good option. Peanut butter cups has both. I don't know if vegetarian is... I don't know if cheese is vegetarian safe, but if I had to guess, I would probably say because they have a gluten allergy, pretzel might not make a lot of sense. I have to understand that pretzels have gluten in them, which might not be immediately obvious to a lot of people. And so my option is probably going to be this buttered popcorn. That's the only other one that makes sense. You can see there's a degree of critical thinking here, and you need to understand multiple components of the question. For example, you don't just need to be able to determine what the preferences are. You also have to know, like, okay, a pretzel has gluten. A hot dog is not vegetarian. Beef jerky is not vegetarian. That can eliminate those options. So there's another level of knowledge you need to have in order to get to that point. Oh, God. For each type of media below, click to specify the entertainment material that would be appropriate for the babysitter to bring. Each type of media may support more than one entertainment. So this is similar to a matrix question, except now there's multiple choices. We have multiple children. One is 14, one is 11, one is 8. And so what we're doing is we're basically treating each one of these like a select all that apply question. And so if I was going to bring a video game Can any of these children have an M-rated game? Child 1 can. Child 2 doesn't really play video games. Child 3 can play E or T if he's with a sibling. So if it's just child 1, I might choose... I think I could choose all of these. However, child 1 only plays racing games. So we can keep easy cheesy because that's a racing game. Child 3 doesn't have any particular selections, so maybe we just stick with the racing options. We could probably keep the sports game on here as well, you know, whatever. Books, I don't think any of these kids are reading War and Peace. That would be wild. Does anyone read? Child 3 likes to have books read to him, but doesn't read himself, so they're probably not going to be doing War and Peace. This kid really likes anime, and then does not like to read. So you know what? I think child 2 is the only one with requirements, so we can go ahead and choose that. You get the point. I'm just going to choose some random ones to move forward. These are closed type questions, which means there are multiple drop downs. And you're completing the sentence by choosing the correct drop down list. Family of 4 is planning to rent a house while on vacation for 1 week. They have a budget of $1,000 and want to rent a house with at least 2 bedrooms. So the question is saying they should get house 3 because it has 2 bedrooms. And it's less than $1,000, so you know what? It's within budget. Doesn't say anything about it being near a ski resort. It has private waterfront, though. PV is included, but the 2 requirements they have are the budget and they wanted 2 bedrooms. So from those options, we can choose those options based on these drop downs. That's how this works. Treat it just like a regular drop down, but there are multiple things you have to do. Next question is select all that apply question. Students reading a recipe. Which of the following instructions are included in the recipe? Does it stay stored in an airtight container for 5 days? It says 3 days, so we're not going to choose that one. And one strategy that works for these is you treat each one like a true or false question in order to determine which one applies most relevantly to your question. So, is it true that you can store an airtight container for 5 days? It is not, because it says 3 days, so we will not choose that one. Roll the dough into 2-inch balls and place on a baking sheet 1 inch apart. It says 1-inch balls on 2 inches apart, so we're not going to choose that. That is false. Preheat oven to 375. That is true, because that is a description right here. Allow to cool for 10 minutes. This says allow to cool for 5 minutes, so we're not going to choose that. Combine all ingredients in a bowl and mix well until dough forms. That is an option right here, so that is true. Bake on center rack for 12 to 15 minutes or edges are golden brown. That applies here. This is the correct answer to this question. I basically went through, chose all that apply that are correct to this question. I used the true or false method and I got to the answer. And then this is another type of drop down. I'm just going to choose randomly. These are closed type questions. This is a matrix and highlighting question, and we're just going to highlight the ones that are most relevant. So you can see a lot of them kind of overlap, but there's a degree of overlap that might happen. Again, select all to apply, but we're analyzing the information. And then we have another drag and drop. So we're going to go through our information. We're going to choose which ones are relevant. So I'm just going to throw some in there. Oh my God, there are so many. Another select all to apply matrix question. So compared to the other one that we had, this one allows you to choose multiple. Is G a vowel or a consonant? It is a consonant. Is W a vowel or a consonant? Sometimes it can be a vowel, so I would choose both. Is Y a vowel or a consonant? Sometimes it's both. D is always a consonant. X is always a consonant. U is always a vowel. A is always a vowel. So you can see I have some that were multiple. I have some that were just one. It's kind of like select all that apply, but in matrix format. And that is it. So as you start getting into different types of practice and really understanding how these types of questions work, I want you to focus on just gaining an understanding of how things can be asked of you. It doesn't have to be nursing related, but it does help to start getting into the mindset. And so what I would do is I would start just looking for different types of sample questions and just starting to get practice in, even though you don't have a full understanding of all the content yet and you're still very early in your nursing career. I think just exposure is a great way to get started. And with that, I will greenlight you moving forward and taking the NGN NCLEX quiz. I think you can now successfully get through that quiz. It allows multiple choices, multiple submissions, which will be helpful. So if you don't get 100 on the first one, go ahead and take it again. It is good practice anyway. And I will see you in class. Have a good rest of your day, everyone.